So I just want to welcome everyone. For those of you who don't know me, although I think everybody here knows me. I'm Brooke Levy. I'm the executive director of the Down Syndrome Network of Montgomery County. I'm really excited to have our officers here tonight, Officer Reyes and Officer Stoughton, and both of them, as if you've seen officers at our step up walks or the car parades, these are two people who you would have definitely met. I know Officer Stoughton came last year, and it's really hard for me to call you Officer Reyes.
Yeah, Lori, just Lori and Amy.
Okay,
Lori, Amy. Yes, got it.
Lori, I've known Lori, I don't know for how many years, because I think I met you before I was the executive director. So
over 15, I'm sure. It's been a long time.
I know, exactly. So it's been a long time. And so I'm really excited to have both of just the representation from the Montgomery County Police Department. And I'm not going to go over our mission because everyone here is part of our community. And you all know what our mission is: to serve people with Down syndrome and their families. And some of the things that I would like to go over are some housekeeping rules. One is we'd like for everybody to stay on mute during the presentation. We welcome cameras on so we can see your beautiful faces. Please use the chat feature or raise your hand using the Zoom reactions to ask questions. We will take questions at the end of the presentation, and I will be reading them to our presenters tonight. For closed captions, you can click on the live transcript and then show subtitles. Please keep questions somewhat general, just because there may be information that Lori and Amy cannot answer, but they'll let us know what they are able to answer. At the end, I will have an evaluation form that I would like for all of you to fill out. That helps us better all of our presentations as we develop new programs throughout the year. So actually, before I introduce our speakers, I would just like to say quickly, one of the reasons why we're hosting this presentation on safety is, as you know, there was a very stressful time, actually the day before the walk. Rashawn Williams, an adult man with Down syndrome, he got lost, and he walked away from his caregivers and ended up in public transportation. And it took, I think, and I know, Lori, you can correct me if I'm wrong, I think it was 6 days before he was found. Thank goodness he was okay. They checked him out at the hospital and he was fine. And I'm sure that lots has been learned from this. However, I received lots of emails from our family concerned not just for Rashawn's safety, but also asking questions about, what do I do if my loved one with Down syndrome gets lost or wanders off? What can we do as families and friends, community partners, to make sure that our loved ones with Down syndrome are safe? So while I know that there's lots of thoughts and feelings about Rashawn Williams and how the investigation may or may not have taken place, we are not really going to be speaking specifically tonight about that. We're going to be talking more specifically about how we can keep our loved ones safe. And so I just wanted to let you all know. And officers Lori Reyes and Amy Stoughton are going to introduce themselves a little bit. I will just say that Lori has been a police officer for a long time, over 25 years, and she is the one who started this amazing autism and intellectual developmental disabilities program and serves our population, and has been for, I don't even know how long when you started it, Lori. You'll have to share that with everyone. She works with that program, and I'm not going to go ahead and read all of this because she's going to talk to you about it. But Officer Amy Stoughton has more recently been involved with our group and came to the walk a couple years ago, which was wonderful. And she also has been an officer for over 25 years. And she also has lots of experience dealing with individuals with many different needs, including autism and people with intellectual and developmental disabilities. And so they work together to support families like ours. And so with that, I am going to hand it over to Officer Lori Reyes. So thank you.
All right, thank you. So I'm always happy to be here tonight, and presenting is probably one of my favorite things I do. It's probably up there because I get those connections. So this is how we're going to do this. I'm going to talk a little bit about our program for those that aren't familiar. It's actually a unit. I don't know, unit program. I call it a unit, but it it goes hand in hand. So I'm going to tell you a little bit about the unit, what we do, and then we're going to go over safety as far as wandering and elopement. But most important, you're going to get my cell phone number and Amy's cell phone number. And I always encourage families to save my number in your phone as Police Lori Reyes, so that if you're in a crisis or you're in a situation and you need something, you could just pull it up on your phone and do my best. We're a unit of 2, right? I do my best. Amy does her best. I carry my phone. I actually laugh. I sleep with my phone. It's kind of like right here. So when I tell you that I try to be and make myself as available as I can, know that if you sent me a text or, you said you needed me, I'm gonna do my best to get back to you. So most importantly, so tonight we're gonna go over the unit, talk about wandering prevention, wandering safety, general safety, and then at the end, I can answer just any general questions you have. So first, the unit. So it started, and Amy, you can just jump in. If I forget something, stop me, Amy, and just jump in.
Okay.
So the unit started in 2005, and it began because at the time I was it actually started in 2004, to be honest. I was pregnant with my second son, and so think of this, 2004. I was tasked with kind of addressing how we could more efficiently respond to calls involving wandering and elopement from a tracking perspective. And I'll go over my love-hate relationship with tracking, but so it started because of that in 2004, kind of digging in a little bit deeper to what we could do to address what we still have, 3 to 8 calls a week for individuals who wander, 3 to 8 a week. So quite significant. And that's in addition to probably our 1 to 2 calls a day for individuals usually on the autism spectrum that we handle for all kinds of calls. Those are big numbers, right? 3 to 8 a week for wandering, and at least 1 to 2 a day for individuals usually on the autism spectrum that we have come into contact with in one form or another. So 2005 started the unit. And what happened, Brooke can say, this is when I started to show up at stuff. When I went back in uniform, I would just show up at conferences, start talking to families. I started following up on calls and just kind of cold calling families and saying, hey, what did officers do that you liked or didn't like, and how can we make the interaction better? So when folks ask, well, where did you get your experience from? Like, what degree do you have? And the degree is in my gift of gab, just talking to people and in immersing myself in the community with IDD, with intellectual and developmental disabilities. I just started to go to things and ask and talk, and then it grew from there. So the program has since grown, and we provide outreach. I used to say awareness, but awareness is gone. It's action, right? We of course we provide awareness, but that's like, come on now, we need to provide action. So outreach, action, empowerment. I think our empowerment piece comes from educating officers and educating individuals and caregivers to be empowered in all kinds of different situations. Education kind of goes with training. We train all of our officers. I have since 2005. Since 2010 when I developed the curriculum. And we in Montgomery County had the curriculum before it was state mandated, before Ethan's Law, before the commission, the Disabilities Commission. We already had our curriculum that we were teaching. I like to see, we were definitely far ahead of, I think, the nation. And in many ways, we still are. And then our last piece is our response piece. I don't necessarily I can't respond to all calls, but if I am working, I will try to respond to calls. And then our most important piece is what Amy does for most of the work, is our follow-up piece. The follow-up piece consists of usually Amy or myself calling a family, and after an episode, let's say of someone in crisis or a wandering episode, calling them and saying, what more do you need? Or what do you need? Or here's some more safety tools. Here's what you should do if you call 911. Here's what you should say or do. And putting them in contact with other resources they might not be aware of. Down Syndrome Network Pathfinders for Autism, our own Health and Human Services resources. So sometimes Amy I know I'm speaking for Amy now, but she can tell you that the follow-up piece is hugely important, and we're well over 500 follow-ups just for this year. And that's a lot of contacts and a lot of families that have either been in crisis or had a child that's wandered or eloped. So it's kind of an intro of the program. Next slide, please, Brooke. Okay, so some of our initiatives, and I think this is important to share so that you can understand the broad reach of the unit. In as early as the start of the program, I was interjecting myself both locally and nationally as it related to legislation, changes being made, kind of hopefully providing dynamic instruction and outreach. So some of our most common things as far as initiatives that you should be aware of, we work a lot with MCPS and other private schools, providing presentations to not only staff and caregivers, but individuals. And, that those presentations go from PEP program all the way through our CLE College for Learning program. I mean, the whole gamut. We really try to provide presentations of general safety, but also interactions with law enforcement and conveying to our folks, if you have an interaction or a police officer is approaching you, it doesn't mean you're in trouble. Or you might get lost, and it's okay. I get lost too, right? So how to ask for help. Our presentations are catered to the cognitive level and the needs of those that we're presenting to. We have a great program that we partner with Pathfinders for Autism, and it's a Drivers with Disabilities webinar and in-person mock traffic stop. And that's for both drivers and passengers of experience of being pulled over by a police officer. We already talked about 500 calls. We provide follow-ups to families, and Amy can tell you, again, there are times when we are the very first contact that a family has had at all with any social services contacting them to give them outreach or any type of services. I think, again, our continual partnership with Montgomery County Public Schools, and that has never wavered. In fact, we're trying to get Amy a after career job as a liaison with Montgomery County Public Schools and Montgomery County Police as a subject matter expert embedded in the schools as a liaison to us as police officers. So we're working on that. And I think, again, it's important to know that our department was the first one to have a dedicated autism IDD official position. And myself and Amy were on a Department of Justice initiative this summer. One of the main things they talked about was the fact that more agencies needed to have a specific named autism IDD outreach officer in at least in all large departments because of the number of calls that we handle for that population. And not only that, but that's especially as it relates to autism, that population growing in prevalency and age and all that comes with the potential challenges in that area. Next slide. So and Amy, if I miss something, Amy, jump in.
Okay.
So we are going to talk about our wandering and elopement prevention first and then response. So again, I think it's important to say we average 3 to 8 usually fines. And when I say fines, meaning we locate the person before family members or caregivers have called us. That is our most common call, especially for our younger individuals. Well, but both. But we call them fines because they're not necessarily searches. Our most common interaction is that we receive a call for an individual who appears to have some intellectual disability or cognitive impairment walking down the road or in a dangerous environment. Officers respond or they come across them, and we're trying to identify who that person is that we are interacting with. And in most cases, we can have them in our care for a couple of hours at times before family members call to report. Not uncommon. So 3 to 8 fines a week. And of course, there are searches, but in most cases, it's the lack of call to 911 for many reasons, right? Most of the time, it's because they think they're going to find them. and then there's a delay. And that happens a lot with our care providers, group homes. It happens with families too, don't get me wrong. But what takes place is that they wait to call. They wait to call thinking either they're going to get in trouble, or they wait to call thinking they're going to find them on their own. And then an hour passes, and then 2 hours pass. And then we're in a situation where we find the person, but we don't know that they're a missing person because the caregiver hasn't told us so, and they're in our care. Delay in waiting to notify is one of our biggest challenges as it relates to having a successful, quick recovery or find of the person is usually that people wait to call 911. So some preventative measures. Most of our caregivers, they know what might work, but here's some that work for us. So we recommend, on a very basic level, a door alarm. I love a Ring, I don't endorse Ring, but any camera that's also an alarm that might send a text message as well is especially important, even in the overnight hours, because the text could wake you up. So installing some type of door alarm, something that notifies you that a door is open, and a camera included in that is a bonus. Also important, we've had many instances where individuals will wander into other people's homes, so especially neighbors. And we have what's called a neighbor letter, and we're just making it a little bit better. Amy and I just tweaked it to go to the print shop. So informing your neighbors that your child may wander or elope is important. And the most common feedback I receive when I tell family members to inform your neighbors is, oh, my neighbors, they all know. Oh, they all know. Yep, they all know. They all know. Here's the truth of the matter. Yes, your immediate neighbors that you're friends with may know, but they may not know what the limitations of independence are. So they see your loved one out at 9 p.m. and your loved one maybe doesn't have that level of independence to be out at 9 p.m. They don't call because they think, oh, well, I guess that's just what's in place in that home, and they don't call. So your neighbors may know, but do they really know what is, so the neighbor letter just basically says, if you see my loved one, however you want to phrase it, out and about alone or at this time, please feel free to call me. And if I don't answer, it's okay to call 911. And listen, we may not get it right all the time. Maybe your loved one is out or taking a walk, and that's okay. And your neighbors call. Well, then we'll figure it all out. But at least that person is safe. So of course, there's always navigation of safe level of independence. And I think Amy and I are on the same page when we'll tell you, we also too understand that there's navigation to independence and there's going to be bumps in the road. So we're here for that, but these are just some measures you can put in place. Another common challenge for us, like I said, is us not being able to identify who the person is that we have in our care. So officers will text me, they'll text me a picture or they'll text me information, and I will reach out to my contacts specific to that age. So if it's a school child, I'll send it to MCPS and try to identify, working backwards, who that individual is. So the ID bracelet, I like the Road ID style, and I love the Road ID style. And honestly, it doesn't have to have a diagnosis. It just has to really say maybe a first name and like 2 or 3 cell phone numbers of people that will answer the phone. So I'm going to skip ahead really quick, and then I'm going to go back. So also prepare a 911 script. Amy and I have also fine-tuned our script that's on our brochure. So the 911 script is what you're going to say to officers or the 911 call taker when your loved one is missing. So when you're in the situation of your kid is missing, that oh crap mode, the 911 script prepares you ahead of time. What do I need to say regarding my loved one to the 911 call taker and to the responding officers? And here's some takeaway. I would never use words like mildly cognitively impaired, or that isn't descriptive, or moderately. I want you to use examples of challenges that could be faced. Can they toilet themselves? Can they cross the street safely? Would they ask for help? So specific examples of what would make them a danger to themselves should they wander. So I think sometimes we want to simplify things, and I'm turning to the idea that especially for care providers, not using a term that's on a paper to describe a person, mild, moderate. No, we need to use examples of why that person is at risk, specific examples. So that's part of our 911 script. And you would, of course, include point last seen. Would they get on public transportation? Have they talked about going to a certain place? Have they been to a certain place that's of interest? All of those things to think about ahead of time. And also, as it relates to the 911 script, letting all who care for your loved one know what to say. Grandma, grandpa, siblings, care providers, letting everyone know what you would need them to do in the event of a wandering episode. Do you want to be contacted immediately as the parent or the care provider? Making sure that you know what information needs to be relayed to the call taker and to responding officers. So I'm going to skip down a little bit. I'm going to go back to tracking in a second. Another great thing is social stories. So having those stories of, what if you get lost? Or where would you go? What would you do? Who would you ask for help? Also a big thing, many of our guys feel guilty if they get lost asking for help. When we do a follow-up, we'll have some of our guys that feel as if maybe not ashamed is the right word, but a little bit of, embarrassed that I got lost. So it's just important to have those conversations and Amy will say, I get lost too sometimes. It's okay to ask for help and say, I'm lost. So in the social story you would create, would say, you would touch on if your loved one was lost, who could they go to if they're lost? Who can you tell if you're lost? Can you show the bracelet to someone if you're lost? All those things to think about. General conversations. Again, some of our guys and girls are just a little embarrassed if they get lost, or they take the wrong bus, they get off at the wrong bus stop, or whatever the situation is, just conveying nonstop that it's okay to mess up. Right? It's okay to not get it right, but it's okay also to ask for help. So just having that conversation. What would you do if you got lost? What would you do? Who would you ask for help? And I'm not going to be mad at you if you get lost, right? The police aren't going to be mad at you. They get lost too. So what we'll do is, I'm going to touch on tracking, but I'm going to make that kind of the last thing. I know it's on this slide, but it's also at the end. School. Make sure that you develop strategies at school. Include it in the IEP. If wandering is an issue or you're worried about it, include that in the IEP and social safety plan that's in place at school or with the caregivers or wherever your loved one is in their life. All right, next slide. And do we want to take a question now, Brooke? If it relates to the slide, I'm okay if it doesn't take us off track too much.
Let me look in the chat. Hold on one second.
Okay. Sorry, you guys. I'm on my phone. Go ahead.
Okay, so Nicole has a question. Do you have an example of a good door camera system that would be good to look into or recommend?
So I do. Of course, Officer Reyes can't make endorsements, but as I sit and say but Lori Reyes, the mom, can. So I like a Ring camera. We've had good luck with it at our house. It's relatively inexpensive. I know Costco has some that are really easy to install. And you can set it up so it sends a text message to you should it alert. Now Ring camera. So RING. But I think there's other ones you can look at, Costco or other ones, but they just do your homework on Amazon or wherever you go to. But the Ring camera, I like it. It works it's pretty easy to use, and it's good for safety. Okay, so with that, I'm going to go to the next page, kind of our other part of wandering, continued on wander elopement. Oh, go back. Did I think?
Oh,
hold on.
I
think I had another page.
Oh,
yeah.
Sorry.
No, it's okay. It's all right. So the other thing we always share is stay calm when you call 911. Don't I know it's so much easier said than done. Don't panic. Take a deep breath, call 911 and be prepared. They're going to ask you a ton of questions, but here's the other thing I need everyone to be aware of. We are, of course, we're shorthanded. Everyone's shorthanded. Our 911 operator is shorthanded. We're shorthanded. You may be in a situation where your child is missing. You're calling 911 and you're not able to get through because it's busy. We just had a mom who experienced that this past weekend. So you're calling and holy crap, you're not being able to get through. Stay calm, just keep calling. It's all you can do. I'm not saying that's going to happen to you. I just want you to be prepared for that in the event that happens, it's a busy Saturday night. We are short officers. The 911 center is in what's called consolidated dispatch, where one dispatcher is running two districts. They're short on call takers. I just need you to be prepared for that in the event that would happen, but we're hoping that doesn't, but just be prepared. Stay calm, and call 911. Be prepared to provide a full description. If you do have a tracking device, an AirTag, or you have something on, make sure that you say that and provide a full description. We talked about the script. Consider having that ahead of time so that you don't forget anything. Make sure you provide those possible interests, recent trips or places mentioned. Oh, Nicole, I know you said non-emergency line, so that's connected to the if your kid is missing, call 911 first. I mean, heck, give the non-emergency line a try, but it's probably going to be, it's all connected. So the 279-8000, it's 307-98000, that's connected to our 911. So you could try and call that one, but they're probably going to be less likely to answer that if they're already not answering the 911 phone. Sorry, go back. Brooke, you're throwing me for a loop. Look, I'm trying to. Okay, so
I was trying to write in the phone number in the chat and I advanced your slide. I apologize.
I got it. So we touched on this before, as open as possible as it relates to navigating the community alone. Use example of challenges rather than a broad one-word description of abilities. Be descriptive as possible. And we talked about that. Will they look both ways? Will they ask for help? The challenge that we have sometimes in law enforcement is determining a person's level of independence or cognitive level. And of course, with officers, even understanding you could have one person with autism, it's anything, any disability that is completely capable and they're non-speaking and they're still navigating independently alone. Same, for you could have an individual who has Down syndrome and it's the same thing, officers, what's the level of independence? They're taught not to assume. So that's kind of to our detriment in some ways because they're taught not to assume a level of independence or cognitive understanding. So for that, we are left to now say, okay, what is that person's capabilities? What are those that individual's capabilities? We have one young man that I've worked with for, 10 years, and he has Down syndrome, and God bless him. He loves his stickers from the mall, and he will leave home and take a bus and go to get his whatever he's interested in. And, God bless his mom. She gives him that independence and doesn't always call. And we get calls from the community on him that says, here's this individual, he has Down syndrome, he's alone, right? And so we say, well, he's navigating. So it can be a challenge for both our individuals with autism and those who have Down syndrome, for officers to navigate what someone's level of independence is. And that's a challenge for us for sure. So be descriptive as possible as it relates to challenges or potential dangers. And again, make sure all who call are aware of what to say, especially support staff. What do you want your support staff to say and do? What do you want the teachers to say and do if your child is missing? Have it written in plain language. What do you want them to do? Calling 911 immediately, saying the descriptions. Okay, next slide. Amy, do you have anything to add? I keep talking. Do you have anything to add that I've left out, Amy?
No, just the stressing to call. The biggest thing I find when talking to parents is that they're afraid to call 911 because they think they're going to get in trouble, or especially if we have one that has had their child or loved one wander in the past, they feel like, oh my gosh, they're going to think I'm a terrible parent. But, we don't want anyone to feel that way. We want you, even if it's 2-3 times a week that your loved one would wander, we want you to call every single time. And I tell parents all the time, if you find them in the next minute, no big deal. Just call back and say, we've located them. Everything's fine.
Yeah, true.
Lori,
Okay, Brooke, next.
I have a question. What if a family is undocumented and has a child with Down syndrome who wanders and gets lost? Should they be afraid of calling the police in that situation?
No. And we stress that all the time. We stress all the time that we are only interested, and I've worked with, both local and national media and outreach with such organizations as, media like Telemundo and different outlets. And we've worked with our Hispanic liaison. And I know, obviously there's many different other immigrant populations, Ethiopian or whatever the case may be. And we stress, we don't care. We just want to get your kid back. And even if your child has wandered and we find them, you take a nap. You got to shower. You've got to eat. You've got to take care of other kids. When we do the follow-ups, most were scared that they would be in trouble. And, Amy tries to convey, you're not in trouble. Even if you have an episode of wandering, just please call 911. Don't wait to call. We're not worried about immigration status. In most cases, we're not even, all that's happening is that we're doing a follow-up. And to dovetail to that, there are times when we need to notify Child Protective Services, but hear me out, okay? There are times when that happens. Let's say, for instance, we had a young lady in our care for about 4 hours who was found in the middle of Shady Grove Road. And maybe not 4, maybe at least 3 hours, okay? Not uncommon. So she's found in the middle of Shady Grove Road. It's in the middle of the night. Dad didn't realize she was missing. In that case, we call CPS because at an hour, who's going to take this kid for us? Who's taking over? So there are times when Child Protective Services is called, but again, no one's worried about immigration status, and Child Protective Services or Adult Protective Services is not necessarily the worst thing to happen, because there are times when you get more services because you're in crisis because of the elopement, so it opens up to possibility for more services. So when Amy and I do a follow-up, in this case, I called the mom. So that elopement on Shady Grove Road happened with a dad, and the mom was out of town. So I called the mom, and the mom was hysterical when I called her. She said, Child Protective Services is coming today, and she was almost inconsolable. And I said, it's not the worst thing. You have my number. We're going to put safety measures in place, and you're going to ask for things that you need from CPS. Let them come back. Say you need locks on the door. Say, get some services in place. So no, to answer your question, we're not worried about immigration status. We just these officers out here just want to get the kid back, or the adult back. Next slide, Brooke. So another part of the response, make sure someone stays at home so that if everyone leaves the home and the person comes back, it's important for somebody to be there, and at least one person to stay at the house. You will have you'll have to share probably more information with the 911 call taker that you will with the officers when they arrive. So maybe have a picture on your phone to provide a better clothing description. The time last seen, that's a really huge one for us, especially as it relates to support staff, meaning an individual who is caring for an individual with disabilities may say that the person, we did a check at 30 minutes ago, but we found the person who was in Germantown and we found them in Clarksburg knocking on someone's door 55. So we know that you probably didn't see him 30 minutes ago. It's probably been a lot longer than that. Again, it's our most common situation is not calling 911 immediately. So again, just make sure you say, hey, you're not in trouble. If I know my kid, man, or my loved one, he's sneaky. He can get right out of the house, and I need you to call as soon as you realize that they're missing. You're not going to be in trouble. We touched on this again in plain language. Give the challenges and limitations that your loved one may have. Being very honest about what the capabilities are. Okay, next slide. Okay, so what can we do for you? A couple of things that and I know one of the questions was, well, how do I, address without putting fear in my loved one? So some things we do, Amy and I do, and I know some of you all may know Officer Bond. We do home visits where we just have a meet and greet and you go over some concerns. You have a loved one that has wandered or you think is going to wander. We do a meet and greet kind of in uniform, and depending on the cognitive level, discuss, in some cases we talk to a young person and say, hey, I know you want to be independent, but you can't just leave the house, right? If you get mad at mom or dad, maybe just sit on the front porch. And then we go over, whatever it is. I'm at a loss for words because we do it for just about all kinds of different things. What else we do? A follow-up and discussion with the family. The most important thing Amy will say is, or I will say, I use humor a lot, is, I mean, crap, you can't watch your kid all the time, and it's okay, and we're here for you, and call us if you need us. That's the most important follow-up component. We also refer to additional resources. Like I said, we try to provide families. We work with MCPS or, whomever it is that would help to get more services for that individual. We do community events. We try to, we just started attending, which is really great event, our Safety Day, Montgomery County Safety Day, that's at the fair in the spring. It's awesome. It's a great place to introduce your loved one to so many individuals in the first responder world. And again, just more coordination of services is what we do. And Amy and I do most of the follow-ups on the calls. All right, next one. So this is my guy. We'll call him Mr. M. Mr. M, we had over 130 episodes of wandering in the course of about 8 to 10 years. 130 episodes of wandering. This young man is non-speaking. He is deaf. He has an intellectual disability. And I use my man M as an example for officers because he navigates his way from, one time he navigated his way from Germantown to Wheaton Glenmont Station. He just is we teach our officers to never underestimate when you're searching. So this young man was in a group home, and he put the pillow with a blanket over top, so when the care service provider opened the door, it looked like he was asleep in his bed and he was gone. And he pulled off the magnetic door alarms that were on the door so that it didn't even set the alarm off when he pulled them off the door. So just saying, never underestimate. Next slide. Okay, tracking. I have a love-hate relationship with tracking, and I'll explain why. So there's products out there. We used to have a tracking program here in Montgomery County utilizing Project Lifesaver, but tracking is really challenging for our guys because it's hard to keep something charged. GPS is going to require almost daily charging. AirTags are good, but it's used as crowdsourced tracking, so meaning it's not true GPS, but it utilizes other people's Bluetooth technology to send a signal that the individual that AirTag is in proximity. So that can be challenging. And tracking, for the most part, like I said, we're locating individuals before we're actually searching for them. So what I say for tracking is really do your homework and never rely on the tracking device. If you get a signal where you think your loved one is, don't trust it. Also call 911. Never ever utilize tracking technology without calling 911. Really, really important. Next slide. So our safety kit, and I know this t-shirt, so I got to take a sip. So we offer an entire safety kit, and obviously it's pretty focused on autism, and that's because obviously most of our individuals that we locate are on the autism spectrum. But of course, it's not just autism, and we've removed it's not just MCP and Autism Speaks, it's just us now. So we provide a t-shirt that's designed for those, and it's really important for me to say, the t-shirt was designed for those that cannot speak and are in immediate danger. So it's not for everyone. It's just designed because if you have someone that's constantly wandering, not even constantly wandering, or has a propensity to wander, the t-shirt just provides officers or community members a chance to know that, oh, this person has a disability or this person has autism IDD, and they shouldn't be alone. Now, of course, not for everybody. I get it. Even when I designed the shirt, I knew there'd be negative feedback, and it's okay because not everybody's journey is the same. And we make it really clear that this t-shirt is only for those that are immediate risk. And it's absolutely saved the lives of many individuals. So we will always provide it, but it's just one tool. Another tool is the window clings. We're going to have some for the home as well that say, a person who has autism or IDD may be a resident in this home. But for the most part, the safety kit is a tool of community outreach to say, right, you're going to have an elopement and we're here for you. So call us if you need us. So Amy, do you have anything to add that I've left out?
Not in the safety kit, no.
Okay. Anything else?
Not that I can think of. Just the
Okay.
importance of stressing again about the calling 911, but again, when you call 911, knowing exactly what you want to say, and again, stressing to our caretakers or teachers or whoever is going to be caring for that individual, so that we're all on the same page, knowing what to say and what are the most important things to convey to the call taker and then to the officers once they arrive on the scene.
Yeah. Again, saying that. Okay. Thank you, Amy. Next slide. I think that might be last slide. So here's my email and my cell phone number. Again, it's not a 24 operation, but it kind of is. So save my number. And again, like I said, save it under police, Lori. And then you could always send me a text or email me or email Amy or email both of us if you had a question. Oh, there's Amy's cell phone number. If you had a question or concern that you wanted addressed. And so that kind of concludes kind of our overview of the program. So Brooke, if you wanted to, I know there's some questions in the chat. We take the ones that came up first from those that are here, I guess.
All right, I'm going to stop sharing so you can see when I will put, and I've got you pinned right now. I don't know if you want to be.
Okay. Thank God I can take my glasses off now.
Okay, so and I will put those phone numbers in the chat in just a minute. Let's see where. Oh, yeah. Oh, there were a couple questions that were sent in, just giving folks strategies to enforce safety without causing fear in our kids.
Again, I would say going back to that slide of if you wanted me to present, if it's a child that's still in school, we're happy to present to the entire classroom. We're also happy to just go to the home and have a conversation or meet someplace. But the biggest thing is to demystify the idea of if you get lost or who you can ask for help, work on that. I make the identification bracelet something positive. If you're out in the community, you can show the ID bracelet to a police officer. Hey, show your bracelet to the police officers that are eating lunch at Chipotle. Introduce your child or adult to officers and have the conversation that if an officer approaches you or is calling for you or what have you, that you're not in trouble, right? That's what Amy and I stress all the time. We just presented to the Catherine Thomas School and saying, you're not in any trouble. And I think that's the biggest thing with our folks thinking that they're going to get in trouble or be embarrassed if they get lost.
Great. Another question was, somebody had asked specifically about tracking devices like Apple AirTags or Samsung smart tags and wanted to know what your thoughts on those were.
Yeah, I think anything should be used in conjunction with also all the other safety measures, keeping in mind that an AirTag or Samsung is not GPS. It utilizes crowdsource. So if your child or loved one is out and they're not near someone who has a cell phone, it's not going to pick it up. So watching YouTube videos on the limitations of AirTags is important, but it doesn't mean that it's not a good tool. It's one more tool to utilize, but just make sure you understand, because we get a lot. Amy just did a follow-up where a man put an AirTag on his wife, but he didn't register it. So it was of no value. He wasn't getting any information. So really do your homework on the limitations and challenges that tracking can bring.
Terrific. And then somebody was asking in terms of just, what is the process? I mean, I know you call 911, you give your, the description or answer the questions, and then an officer comes. What if your loved one isn't found right away? Like, what is the process? Like, what would a parent or a caregiver or a family member expect?
It would really be on a case by case basis. They would consult with our search manager team. It can be an all out search, or it can be, that's why it's really important to relay all information as it relates to cognitive abilities and in plain language, and some examples of what they can or cannot do. And of course, that would dictate how the search was conducted. And it really depends on a case by case basis how they're going to proceed with the search, what kind of resources they're going to put in place. And again, we handle our search and rescue guys, I think, handle close to 4,000 or something searches a year. So they are pretty proficient, but it's just a matter of make sure that the caregivers call right away and that the information provided is very descriptive.
All right, great. Thanks. There's a few more questions here. And let's see. So in relationship to Rashawn Williams, is there anything that families can do since in terms of like the alert system, is there anything that can be done to change the alert system to include people with intellectual disabilities who are not minors?
Yeah, so
that aren't in a car.
Or in a car, right, through the Amber Alert. So that would have to be done through a legislative action. That wording, that update, there's other states that have done it. And I know that there was the reasoning for not having the alert attached to, there's many reasons why. There was a self-advocacy group that was against it. There's reasons why that it wasn't included. I'm not saying good or bad reasons, but it would have to be done from a legislative change to change the wording of who the focus of the alerts would be. And I think for reference to the Amber Alert, they were worried that it would desensitize the Amber Alert. Too many of those alerts would go out. But I think, you'd have to address it with your local leaders, whomever that may be at a state level, to change the wording for that.
Mm-hmm. And just for those of you on the call, also, I know that ARC of Maryland is working on that at the state level, and I've asked that they include us as DSNMC to help facilitate that or help advocate to include our adults with Down syndrome or just anyone who's not in the car. There are a few more questions. I hope that's okay if we just take up a little bit more of your time. Yep. Christy asked about, is that she thought that maybe she heard you in a different presentation talk about mentioning bodies of water that are near or around your home. Is that still something that is important to state to like an officer or 911?
Yeah, and I usually that is true, and that's usually specific, or I should say it's more specific to individuals on the autism spectrum. Drowning being the leading cause of premature death for individuals who have autism. But of course, for any vulnerable individual, water is important to be aware of, because there's really no forgiveness with water, right? That significantly cuts down the time and makes the search even more dangerous. So yeah, absolutely. Going to bodies of water, making sure you're familiar with pools and ponds and the draws that our guys and gals might be drawn to. So yeah, that's true.
And most of our officers, just from being in patrol, anytime a call goes out, especially like she said with our autistic individuals, the one officer is always going to respond to the house to take the initial report. But understand that as that's occurring, our other officers that are on our shifts are automatically, because they're trained, they're automatically going to these bodies of water. We have maps. We know where, look at the addresses. It's important to say, hey, I have a lake that's behind my house or a creek that's behind my house. But officers are trained and know as soon as they hear that call going out, most of us are going to start heading towards dangerous places.
And I'll only dovetail on that because the truth of the matter is we also have a shortage of officers, and that can definitely impede in response sometimes. I mean, that's just the truth. And I know I'm being recorded right now, but there's a shortage of officers. So, in certain times in certain districts, it's going to be a challenge because you might have one officer working at that time, say Silver Spring or Wheaton, one officer working because you're working a lot of other critical incidents at that time. And so it can be a lot of juggling to consider. So it's something to consider as, you and Down Syndrome Network and ARC talk about legislation, making the amount of officers is also important. That's not your role, but something to think about, the idea that there could be a shortage of officers in that situation. So what the resources are.
Thank you. A couple of people have mentioned that some of our loved ones do not necessarily differentiate between a stranger and a friend. And so what are options available, especially, in today, a lot of us, when our loved one becomes 18, we are not necessarily becoming guardians of our love. Like back, a lot of, with those people who have older people with Down, have loved ones with Down syndrome who are older adults. I think that it was much more encouraged, for families to become guardians, and for those people now who are a little bit more independent and do more supported decision making, and guardianship isn't automatic now when somebody becomes 18. What do we do, like when our 18-year-old who's barely an adult basically goes off with somebody who's a stranger, but we're not the guardians anymore? What do we do?
So we just had this. So here's the thing. We just had this. Amy and I were on a follow-up call for a young lady that she is not under guardianship, and she took off with a young man, and she's 23 years old. And so it's tricky sometimes, and that she's telling us that she's going on her own free will. She's 23 years old. We have a conversation with her. She says, I'm fine. I don't want to go back to my mom. I don't get along with my mom. And we have to tell mom, I'm so sorry, but we can't force her to go back. We can't force her. Now, I think that's the challenge that all of us are trying to figure out. Law enforcement, parents, we're all trying to figure out how we're navigating that. Now, Amy and I, in that situation, we're going to think outside the box, right? We're going to try and talk to that young lady as two females talking to another female, right? Or we're going to determine what steps can you take? Can you get a protection order? Can you get temporary guardianship because the situation is such that they're making bad choices, and you go to the courthouse and you get a temporary guardianship articulating the challenges of the disability, that she's not making sound decisions. But Amy and I and others, and other officers are pretty good at it too, navigating that circumstance. But that's the challenge of figuring out independence. There's going to be those bumps that we're all kind of figuring out and trying to think outside the box. And the answer might not always be, it's hard. That's the truth of the matter. We have a lot that we work with that are in that same situation, making some bad choices that really frustrate us, but there's not a lot we can do sometimes.
Lori, does your unit ever do outreach to MCPS where you go in and you help people with IDD in the school system distinguish between friends versus strangers?
Yeah, we have a whole program that we offer. That's part of what we do in the schools. So for instance, we go into the classroom or we go into the auditorium, and we do it with all programs from LFI to ED to autism classrooms, or we bring all of the classes in together, have a presentation we introduce ourselves, we talk about community safety, interactions with law enforcement, and stranger navigating the community. So that's part of our that's part of our presentation. Again, I know I have a captive audience here, but that's what we're trying to do with Officer Stoughton, who's retiring, maybe being that coordinator within MCPS as a liaison to MCPD. So Amy and I leave those presentations. Every single class, every single student should have that presentation, but we just don't have that capability with so many classrooms and 2 officers in this unit. But yeah, we try to do the best to spread ourselves thin and go to those classrooms whenever we can.
That's great. And other than Nicole's funny little story, which could be a good way to end. I don't know. I can read it here. I don't know if everybody saw that. She had a funny story about her daughter, who is adorable, by the way, you might say. When they were in New York City, she wanted to walk up to a police car, and she can be adamant. For those of you who don't know her, when she wants to do something, she's going to do it. She's very cute and funny. Anyway, Nicole had to talk her down, but she just wanted to get in that car. But thank goodness they were very good about it, which I'm sure they are. I've found that to be the case for, most of the time, because my daughter also, she'll see a police officer or a firefighter, and she sees them as community helpers and wants to wave at them and everything. So that's
we love that. Yeah, we're wavers too. So no, thank you for sharing that. And we are here, we're here for everybody, and Amy and I really try to make sure we are. So if you need us, reach out, please.
Thank you so much for coming. If you haven't done it already, please, I added a link. I'll copy and paste it. There's an evaluation form.
You can rate Amy's Christmas tree.
Well, you know what? It's lovely, by the way. Anyway, it helps us with getting grants in the future, just being able to get the information. And also it helps us learn. There's questions asking you about what you'd like to see presented in the future. You have a lot of thank yous in here, Lori and Amy. So thank you so much for coming. And this was great. It's given me a lot to think about, just in terms of, presenting in the school system, but also we will be, after the new year, starting a relationship workshop, or a series of workshops, all the way from, puberty and what kids go through during puberty, through intimacy, but in all of that, healthy relationships. And that can, I think it was Scott, I don't know if you wrote the question about just how to differentiate between friends and strangers. That will be covered in that workshop, because we need to know who are our friends and what does it mean to be a friend, and what are all the steps to becoming a good friend, along with other kinds of relationships, and just learning about different kinds of relationships. And I think that in itself is key for anyone growing up, but there's a lot more steps that we need to explain to our loved ones with Down syndrome so that they are safe.
Well, count us in. We're always here, if you needed something. So please know that we're happy to present, or we're happy just to listen in and be an ear. So just let us know.
All right. Well, thank you so much. I'm going to turn off the recording, and this is it for the evening. Unless somebody wanted to ask another question, I just see lots of thank yous. So thank you so much, Lori and Amy.
Thank you, guys. Good night, everybody.